Hello student, welcome back to this channel. Today we are going to study about the arrhythmias. So basic concept behind the arrhythmia. Actually arrhythmia is one of the most difficult topic in cardiology and somehow everybody struggle with this. So in this session I will try to simplify arrhythmia as possible as I can and I hope you will learn it very well. So let's start with arrhythmia. So what is arrhythmia? It is a abnormal heart rhythm. It could be fast or it could be slow. Now in this topic specifically I would like to clarify about few terminologies, that is supraventricular, ventricular, what are narrow complexes, what are broad complex, what is aberrancy. So if you are clear with this terminologies, I hope the future journey will be easier. So arrhythmia divided into two parts. First one is tachydysarrhythmia. Second is Brady dysarrhythmia. Okay. So we will focus mainly on tachyarrhythmias in terms of this terminologies. So tachydysarrhythmia are divided into two parts, that is the supraventricular and ventricular. Before understanding what is supraventricular and ventricular dysarrhythmia or tachyarrhythmia, first we will revise few basic things. That is, the impulse is generated from SA node, then SA node to AV node, then AV node to bundle of His, and from bundle of His to right Purkinje fiber and left Purkinje fiber. Okay, just imagine this is your left ventricle. Okay, or you can say the ventricles. It is a left ventricle, it is a right ventricle. This left Purkinje fiber will depolarize the ventricle, and when the ventricle is depolarized we will get QRS complex, right? So in any tachyarrhythmias, whenever there is a flow of current that follows its natural pathway, then this QRS complex will be narrow. Why I am saying like that? Because normally if the tachycardia follow this route from SA-AV bundle of His and Purkinje fiber, then the ventricle will depolarize through left Purkinje fiber or just Purkinje fiber. So to depolarize this ventricle, Purkinje fiber takes very less time. But whenever there is a breach in this natural route, whenever there is a breach in this natural route and ventricle are depolarized by external factors, such as if there is an external foci that generate impulse to depolarize ventricle, then what will happen? It will create QRS complex, that is broad QRS complex. Now why it create a broad QRS complex? See, this transmission is neuronal transmission, right? But whenever there is a foci or there is any pathway that will create an extra pathway that directly connect to ventricles, what happen in these conditions are, in this condition and in this condition, the ventricle depolarization is start with the intramyocytic conduction. So whenever there is an intramyocytic conduction, it will take longer time. So our QRS complex is broad. I hope you understand. Whenever there is a normal path, there is a conduction through neurons. So it will be narrow complex because it takes less time to depolarize ventricle. But in case of foci that is other than the natural pathway, such as from AV to ventricle or from foci within the ventricle, then it will create depolarization of ventricle through intramyocytic condition, which takes a long time. So it will be broad QRS complex. Now what are the supraventricular complexes? That is supraventricular tachycardia. Supraventricular tachycardia, SVT. So SVT are any tachycardia that caused at AV node or above AV node. This will be considered as a supraventricular tachycardia. And what about the ventricular tachycardia? Any tachycardia originated at bundle of His or below the bundle of His, right? If the tachycardia is originated at AV node or above AV node, that is SA node, or within atria as a foci, then it is a supraventricle. And whenever there is a tachycardia below bundle of His or at the bundle of His or at the ventricle, anywhere, it will be considered ventricular tachycardia. Now tell me one thing, if we consider supraventricular tachycardia, so in every supraventricular tachycardia, the normal neuronal pathway will be there. Like if suppose there is a foci at atria, so it will depolarizes SA node or it depolarizes AV node directly. After depolarization of AV node, it will eventually depolarizes bundle of His and then right and left Purkinje fiber. So it will follow its natural path. So what do you think, what we will get in QRS complex? We will get QRS complex narrow, right? What about the ventricular tachycardia? Most of the ventricular tachycardia will start with the foci that is within the ventricles. So if the foci is in ventricle, so we will get which QRS complex? That is a wide one. Why? Because there is a intramyocyte conduction, right? So I hope you are satisfied with this explanation. Supraventricular tachycardia, we will get narrow complex QRS complex, and in ventricular tachycardia, we will get QRS wide complex. One more thing is that, do you think every supraventricular tachycardia will have narrow QRS complex? Do you think that? No, not every supraventricular tachycardia will have narrow QRS complex. Why? Because there are some condition in which there is a bypass of ventricular depolarization. Suppose this is your SA node, AV node, bundle of His, right Purkinje fiber, left Purkinje fiber, and this is your ventricles. Suppose this is the foci of generation of impulse which is at the atria. This will depolarize SA node. This will then follow AV node. Now what happens if there is any alternative pathway that goes from AV node to ventricle through direct pathway? That is, this is the accessory. This is the accessory pathway that goes directly to ventricle to depolarize it. So in this condition, ventricular will depolarize through intramyocytic conduction, right? So what we will get? We will get broad QRS complex. So we can say any supraventricular tachycardia with aberrancy Then we will have QRS complex broad, aberrancy or accessory pathway. So we will have broad QRS complex. So this is clear, I think, right? This is the basic behind the supraventricular tachycardia, ventricular tachycardia, aberrancy, and broad and narrow QRS complex. Classification follows with narrow or broad. So in narrow QRS complex, we either have regular or irregular or irregular. In broad, we also have these two categories, that is regular or irregular. Okay. So what are the regular narrow complex tachycardia? Regular narrow complex tachycardia is sinus tachycardia or AVRT or AVNRT or atrial flutter. What about the irregular one? Atrial fibrillation, multifocal atrial tachycardia, we called it as a MAT, or atrial flutter with variable block. Then what about the regular tachycardia with wide QRS complex? It is a ventricular tachycardia. Then it is a antidromic AVRT. Then it's any supraventricular tachycardia with aberrancy. So this is important because in a question you will be asked like identify the wrong statement. So they will give SVT will always comes with narrow QRS complex, whether it is right or wrong. So you have to identify those questions and make it right. Then what about the irregular one? There is a polymorphic VT. Then there is a any supraventricular tachycardia with aberrancy. That is those irregular. So any irregular with aberrancy is irregular broad QRS complex tachycardia. So let's see which of these are supraventricular and ventricular. So sinus tachycardia, it is a supraventricular SVT. AVRT, it is a SVT. AVNRT, it is SVT. Atrial flutter, it is SVT. Atrial fibrillation, it is SVT. MAT, SVT. Flutter is SVT. What about the regular one? These are VT. This is also, this is SVT, but it is broad QRS complex due to antidromic. We will discuss about the what is the antidromic and orthodromic. So this is the basic classification I think one should know to understand the tachyarrhythmias. This topic is important. This concept is very important about the foundation of tachycardia. Now what about the Brady dysrhythmia? So it's a simple, it's a first degree block, it's a second degree, it has Mobitz 1, Mobitz 2, and it's a third degree. So we will discuss in further chapters how exactly these all tachycardias and bradycardias will appear on ECG and what is the basic pathophysiology behind the every arrhythmia. So thanks for watching. We will continue this in next session. Thank you.